That's sort of fueling that whole Blue Monday sentiment that we're in the middle of this surge. But if you look at some of the models from our health systems and so forth, locally they're saying by the numbers, next Tuesday it should begin to peak in terms of the rate of infection if people continue to exercise some level of caution to keep the spread down. And hopefully on the other side of that, we'll begin to see a light at the end of the tunnel.
And so we're obviously in a pandemic. There's also a new term that's been coined called an infodemic, because we're in this area of all of us sharing health information, and I don't think that it's in a sinister way. Most people are just looking for a solution. You know, a family member gets sick, they can't get a hold of the doctor for whatever reason, or the doctor says call me when you get sicker. You go to the internet, you look for the best possible advice, and oftentimes we're finding out that that advice is just, there's no scientific evidence that it works, but people are desperate. And so now this study is revealing that this has actually been a problem for some time with us going to the internet for our medical advice.
It's sort of been amplified because of the pandemic, because there's so much information, and in that so much misinformation being shared on so many platforms, and also the topic of your health and how it relates to the pandemic has been wall-to-wall coverage on cable networks and on network television. But yeah, when they compare the amount of misinformation related to the pandemic from February to April of 2020, and then they go back a year earlier, you can find evidence that people were sharing all sorts of health misinformation about a range of things online, whether it be, you know, this new study related to MS or this related to a cure for cancer. And in many cases, the information was false, either leading to false hope or leading to people diagnosing themselves based on information that's not true. That's the trap. My doctors warned me about that forever. Don't get on WebMD and try to diagnose yourself.
I hear them, but then sometimes you go to the doctor. Well, it's such a brief appointment, you guys. I mean, do you get the time with your doctor to actually sit down?
Well, you know, my doctor's gone concierge medicine, so I pay out of pocket extra for that. And I will say, the experience in his office, pre-concierge, post-concierge, is very different. And yes, he does spend a solid hour with you post-annual physical, and before you might have only saw the physician's assistant. But I understand what you're saying. People are looking for as much information as they can because they don't feel like they're connecting with their doctor in a way where they can get all their questions answered.
I really think we're just in a place where people are so desperate, and especially with COVID. And I know obviously our healthcare system is doing the absolute best that it can, so it's not a criticism of them. But when somebody calls, they get a positive COVID diagnosis, for example, and they want to know, okay, well, what can I do to make sure I don't go down a wrong path? And they're told, well, call us when you get sicker. They do. They go online, or their family members go online thinking, is there a supplement? Is there a something I can do, because, you know,
to care for myself while I'm waiting for this appointment.
Yeah.
And how about, I mean, we have a colleague who got a test on January 12th, still doesn't have the results back. It's been 5 days.
Unbelievable.
How can you plan your life around this pandemic if you can't even figure out whether or not you're COVID positive? I mean, that's just an issue.
They say, but take the home test, but get the home test, but it might be wrong. In fact, it's probably wrong, but buy it.
Yeah, and then go down to that line and sit there, and if you get a negative test, don't go to work. But if you never get a test and you don't have symptoms, go to work. It's not confusing at all.
Oh,
the information around all of this, I think sometimes the CDC is contributing to the infodemic, because their guidance is like this way, that way, clarifying stuff. I'm like, really? Do you realize that we're all seeking guidance here and information that we can all understand?
We want a plan. Like, send us a plan. Tell us what to do. Okay.